People of St. Martin, I come to you today as Chair of the EOC and Prime Minister on April 6, 2020, to update you, as per usual, on the updates as related to the COVID-19 response of government. The first point I'd like to make this evening, is regarding supermarkets and food suppliers within the regulation of this 24-hour curfew. After a meeting held today via video conference with our food suppliers and representatives of the supermarkets on St. Martin, I would like to announce the following. All food suppliers will be allowed to do deliveries as of tomorrow, April 7th, to clients, which includes smaller grocery stores, as well as deliveries to the French side and shipments to the neighboring islands. This also includes deliveries to their clients, individual clients, who will be doing their orders via email, via WhatsApp, or via phone. Contact numbers and emails will be published via DCOM for persons to order from the supermarkets or grocery store nearest them, only for urgently needed items. This decision was taken seeing that many feel that the persons on St. Martin who were unable to do their shopping for groceries over the past few days prior to the shutdown would feel an urgent need and therefore resort to breaking the laws. Also, the supermarkets brought forth that they had many perishable items, which if they were able to deliver those, that this would not then go to waste. I would allow this to happen as long as all adhere to the regulations in place to do so. The supermarkets have received the conditions under which they're allowed to do deliveries, being 1, that they would submit the proper waiver document for their workers who are needed internally to package boxes, as well as for their delivery service. Also, they must ensure that all of their employees involved in this scheme are healthy. No one who is ill is allowed to work. The supermarket and/or supplier will be held responsible if thus is allowed. All deliveries must be on a no-contact basis, whereby the deliveries will be brought to the door or to the facility, and that the payment is either made upfront or when it takes place of encounters as little contact as possible. All of the supermarkets, including small groceries, will facilitate this delivery system as per their capacity. Therefore, if a supermarket is only able to do 20 or 30 deliveries in a day, then you will be informed when you make your order on what day or time you can expect your delivery. All supermarkets will remain closed to the public. Therefore, you are not allowed to go to the supermarket or grocery store from your home. Later this week, the EOC will take the decision regarding the allowance of individuals who may not have benefited from the delivery system to be incorporated tomorrow, to allow them to be able to move in the districts where they live according to their last names. This will be taken later this week, and the general public will be updated as to whether this will be allowed or not. Of course, the feasibility of the enforcement of such a movement has to be taken with the police department along with their stakeholders, as the main reason for this strict lockdown is so that we can contain the virus, thereby minimizing movement of people. So if you do not, let me repeat, if you do not have an urgent need for food, do not clog up the lines ordering food via your supermarket or grocery store, and leave this only for those who do not have basic needs in their homes. This is not for luxury items. This is solely for basic needs. I ask and hope that the compliance of the public will allow these deliveries to continue in the interest of preserving food, preserving orders that continue to come into the island. The suppliers have indicated that fresh supplies have arrived on Sunday and Monday, and therefore it is especially to be able to disseminate these fresh goods, which are fruits and vegetables for the most part, that we are allowing the deliveries to take place. It will put a stress on our law enforcement, and therefore I ask that persons with waivers to deliver food utilize them solely for that purpose. This is a privilege being granted to you, and I must reiterate that the suppliers and supermarkets must also provide protective equipment for their employees, my apologies, to be able to execute these deliveries as safely as possible. Food deliveries by government has already begun to our most vulnerable citizens who have been on our list and who have contacted social welfare and social services via the stmartingov.org/coronavirus website under the Forms, Laws, and Protocols option. That is the button you must click to find a form to be able to register as being negatively impacted by the socially by the economic downfall resulting from the COVID-19 pandemic. So look for that form under www.stmartingov.org/coronavirus under the Forms, Laws, and Protocols option. Under this option, you also will find the forms necessary to be able to move if you have a medical emergency or a personal emergency that cannot wait, and thereby requesting, of course, the necessary approvals from either Chief John, myself as Prime Minister and Chair of the EOC, or the Health Minister. I would also like to update on a meeting held today with our French counterparts. The meeting was a video conference held with Madame la Préfète, Sylvie Faucheux, Vice President Damaso, First Vice President Damaso, as well as President Daniel Gibbs, Commandant Basso, as well as a translator, Miss Wendy, and I thank you for the translations. During this meeting held with our French counterparts, we were able to update on how our border controls as well as internal controls are moving along. It was realized that the border at Oyster Pond had not been blocked as per agreement. This will be rectified today. Also, the controls will continue on both sides. So all those persons needing to travel over the border should ensure that they have a waiver that has the proper approvals, or that you are carrying a valid disaster pass. The disaster passes of the medical professionals is at the back of their SMMC ID, and therefore I expect that both sides, in terms of border control, will be able to recognize and respect this. All others needing to cross the border must fill in the form that is made available by the French side, or Form 3 that is on our same website that I mentioned earlier under Forms and Protocols. Out of the discussion, several options came forward whereby Dutch and French will be collaborating also towards the improvement of taking care of our vulnerable. Thank you, President Gibbs, for the offer that you have made. Those offers will be discussed further with ESF 7, which is our Community Development and Social Affairs ESF, to be able to ensure that all persons who are in need will receive the necessary assistance as it relates to food. I also would like to update the general public that in a meeting held today with ESF 6 and the general practitioners, the doctors, it was ascertained that doctors' offices will remain open, especially for emergencies, and to allow doctors to work from their offices to stay in contact with their clients and patients. The doctors will continue to serve their patients on the phone or online, and all patients needing to see their GPs face-to-face should send that request, or the request would come from the GP to the Minister of Health, who will sign off on those approvals, which allow the patient to move from either his or her home, to the doctor's office, or to the pharmacies. Patients are asked to stay in contact with their GPs. All of the numbers have been published on government's website, and only to call 911 or 912 for real emergencies that cannot be dealt with by the GP. If too many emergencies are going to the non-emergencies are going to the emergency room, this will cause a further burnout, which is unnecessary, as we would like emergency personnel at the hospital to only be dealing with real emergencies. As you know, we have COVID-19 related emergencies as well as regular emergencies. And as so many are off the roads, we do then hope and expect that there will be zero, for instance, accidents that would cause any calls to go to the emergency and to our ambulance. Prescriptions will be sent via email or WhatsApp to the pharmacies, which will then facilitate delivery to the patients. I'm hoping this is now clear to all GPs as well as patients, and including those quarantined and isolated persons who need to also remain in good contact with their GPs so that they are properly monitored should their symptoms become worse, or in terms of our quarantined, should they start to have symptoms at all. You're reminded that if you are in isolation, you should be the one wearing a mask to protect your family. All those who are venturing out on the roads at any point during this shutdown period should wear a mask to avoid spreading anything that they may have, and others, if we all do that, then we will avoid spreading any type of virus to each other. Our mandatory isolation location is up and running. 3 square meals per day are being provided. I would like to thank the Minister of Finance for the key role he has played in this, and ESF 6 as they continue to coordinate with between CPS and the AUC students to ensure that these patients remain under proper isolation with healthy food, good service as medical service, and also ensuring that they receive the necessary psychological support. Point 5 is the waivers. Today, the police has noted that over 1,000 persons have requested emergency waivers. We find this an inordinate amount. We would like to ask the general public to reserve these waivers or the use of waivers for urgent reasons only. If we have 1,000 persons who are not essential personnel moving on the roads, this will not help with the shutdown and therefore cause it to go much longer. Patience and discipline. If it is not an urgent matter, stay at home. Do not even request it. Persons who are taking care of the elderly, of course, are allowed, and this would fall now under medical, so this should go to the Minister of Health. That is richard.panafleck at stmartingov.org. This will also come out via DCOM, that people can see this on our website, so you do not have to memorize what I just said, but all emergencies related to health, the waiver form, and only a waiver form. Don't just send a random email. The minister can only sign off on actual waiver forms. So if it's an urgent matter that is medically related, you have to sign the personal waiver form. If it is a professional form, so if you work for a GP, a general practitioner, or you work at the pharmacy and you do not have a disaster pass, you need to have a professional waiver. This will be sent to the minister to be signed off. If you are working for SMMC, the ambulance department, or any other emergency medical, you should have your own disaster pass. Again, any medical personnel needed that don't have a disaster pass should have a professional waiver that will then be signed off by the Minister of Health, Mr. Richard Panafleck. I would also like to note that all emergency personnel and essential personnel that are working are also qualified to make use of the gas stations, as well as the service and maintenance that has been arranged for this purpose. Groceries, as I mentioned before, is now able to be delivered as of tomorrow. And of course, medical and emergency personnel will have preference for delivery over all others. Point number 6, and my final point for this evening, is the Mental Health Foundation has announced and has made clear via DCOM that those needing emotional and psychological support can contact them via 311. I hope to be able to bring you more numbers that are available to the general public, but stay tuned every day to our stmartingov.org/coronavirus website for daily updates, and our Facebook page at Government of St. Martin, as well as Government Radio Station 107.9 for official information. I understand that there are still persons out there being very malicious and putting out fake news. If it does not come from a government entity, please disregard, ignore, and do not share. Do not be part of the blatant nonsense and waste of time that is going on in then making an official statement from government that this is fake news. You're wasting time and resources and therefore blocking necessary help that could be coming to you or your own family. People of St. Martin, as I conclude this address, I only want to remind you that each and every measure that has been taken over the past month has been with you in mind, your safety and your security. We want to be able to spend these 2 weeks to be able to properly assess what is going on in our community. I have not received the updated numbers as yet as it pertains to the cases. As soon as those are available, they will be posted on our government's website as soon as I get them, and they are official. We do not want to put out information that is inaccurate and cannot be corroborated. So whatever you hear on the road, when you see it on this page of the government information, then you know for sure it is the real news and that can be shared. You do not need to know each and every human that has COVID on St. Martin. You only need to know to keep yourself safe. Today for you, they say, tomorrow for me. So don't wish bad on your fellow man. Save what you have, preserve what you have, spend this quality time with family, communicate via online services as much as possible, pray, worship. We are in the middle of the Holy Week. This is a great time to reflect and connect with your God. I ask you for patience. I ask you for discipline. We are all in this together. I want to take the extra special time to thank the government of the Netherlands for heeding our cry for assistance in sending the much needed IC beds as well as extra ventilators to assist the St. Martin Medical Center, as well as the medication, as well as the personnel that will arrive on the 7th and 8th. We also have confirmed that the visiting epidemiologist and infection control doctor will arrive also tomorrow. And we are very, very happy that she actually has some roots in St. Martin. This is a great and wonderful opportunity, and we look forward to continued cooperation, collaboration, and compliance from the people of St. Martin as together we fight to mitigate the spread of this worldwide pandemic, COVID-19 virus. Stay safe, St. Martin. God bless you. Until we see each other again, be safe.